everybody. Great to have you with us. I have Dr. Gio Espinosa, well-known functional naturopathic urologist, specializes in men's health. Many people have been to his website, drgio.com, drgio.com. You can see it on the screen right there. And so, Dr. Gio, thank you for coming back on the program.
It's my pleasure, Mark. Thanks for having me.
Well, as an expert in men's health, obviously prostate issues are a very big topic. About 50% of men who are age 50 have enlarged prostate, and that goes up as men get older. So very, very common. And we have some very good things in nutritional medicine, naturopathic medicine to help keep that prostate healthy, reducing or preventing it from, growing, and other prostate related issues. So what is it you have found in all your research? You've written books on these types of things. What's going on with prostate enlargement? Why is this so common in men?
All right. So as men get older, their prostate tends to get larger. Not all men, and even healthier men. So somebody said, well, I'm healthy. Well, even quote unquote healthy men, let's say they exercise, they eat well, whatever that means for them, they some of them still get develop an enlarged prostate. So for the most part, all you need to do is have a prostate and get older, and your prostate will get bigger. Okay? Why does that happen? And more importantly, why does that matter? The assumption is that if a man has urinary symptoms as he gets older, right? Wakes up 3-5 times a night to urinate, urinary frequency, urgency, straining, that's automatically due to the prostate. And that's false. So a man can have an enlarged prostate and not have urinary symptoms at all. A man can have a small prostate and have urinary symptoms. Because all that matters is the area called the transitional zone around the urethra, the tube that brings out the urine, is that area being squeezed? That's all that matters.
Right.
So you can have a small prostate and that area is squeezed. You have a big prostate and the transitional zone is not squeezing in the urethra. So that's a very important distinction, because sometimes what I see happening is that men have older age BPH, or they don't have urinary symptoms, but they see that they have BPH and they put them on drugs unnecessarily. Particularly the 5-alpha reductase inhibitors, which tend to stop the production of DHT, but then men develop all kinds of sexual issues, sexual dysfunction and all kinds of things unnecessarily. So that's important.
Absolutely.
Okay, let's say a man has BPH and urinary symptoms. What's happening, right? What's happening is several things. Number one is overstimulation of the sympathetic nervous system. Some men just, if you can actually link urinary problems, maybe related to prostate, maybe not. As men get older, oftentimes men are not sleeping as well as they get older. So there's a link between their sleeping patterns and their urinary problems. Constipation, right? So there is a colon bladder connection going on, that men who are constipated tend to pee more. And that makes sense because the rectum is right close to the prostate. So it's, so a filled rectum can actually squeeze on the prostate and cause all kinds of urinary symptoms. So you want to make sure that you have a healthy digestive system and that you're not constipated. So sleeping better and avoiding having normal bowel movements is very important, right? There's hormonal changes that occur. Oh, wait a minute. I thought that it was high testosterone. If I have high testosterone, that's bad for my prostate. No, that's false. That is false. And I think that's one of the biggest misconceptions that still exist. What happens is, as men get older, they have less testosterone. So if testosterone is the problem, is the main issue for prostate problems, then 25-year-olds would have prostate problems and urinary problems. And that's not what we see happening. So an imbalance between, and an imbalanced ratio between testosterone and estrogen seems to be the bigger issue, where there's less testosterone and more estrogen. So too much estrogen relative to testosterone as men get older, that's another issue that contributes to prostate enlargement, that then contributes to urinary problems, LUTs, lower urinary tract symptoms. Okay, so in a nutshell, sleep problems, gut problems, and hormonal imbalances and ratios. If you put a gun in my head, tell me the three things for BPH. Those are the three things. Those are the three things, in my opinion.
Yeah, that's unique. A lot of doctors would not summarize those as root issues that need to be addressed. So very, very good. And for the viewers, we're going to have separate videos on different ways to help prostate enlargement, diet and supplements and things like that. Also prostate cancer. So look for those videos with Dr. Gio and I. You can go to my website, 𝐼sNaturalDoctor.com. You'll be able to see them there. Remember, check out Dr. Gio's website, drgeo.com, drgeo.com. And Dr. Gio, great to have you on, and look forward to these future videos where we go into some of the treatment protocols that you use.
Thank you, Mark. Thank you. Thanks for having me.
Thank you.